Perhaps we can make an early start on the presentation from Georgia from the UNDIS team. Although I see Rika has joined us.
Yes.
Fantastic.
Apologies, I'm really sorry I am late. Yes, the ministry devices do not really cater for Zoom, so we cannot have the app, and yeah, so I had some technical challenges. Apologies for being late.
No problem, thank you. I think given that it's a public holiday tomorrow, there's a few people who've been a little bit late in joining, so no problem at all. I'll hand over to you.
Yes, so welcome everyone, and thank you for joining us today. Again, apologies for being late. So my name is Rika Mikkola, and I'm the co-chair for the working group. I have worked with some of you already in 2019. I was away for a few months from the office, and at that point, Maria was covering from the ministry, and I believe you have worked with her. Given that I was late, so I don't want to delay anyone's preparations for the public holiday, I think we better get started, and I'll be with you more towards the end of the meeting when we have some discussions on sort of more strategic questions regarding the working group.
Great, thanks Rika. So as I mentioned just earlier, we will have a presentation starting off from Georgia, from the UNDIS team. I just wanted to check, Emmanuel, are you able to share the presentation and we can hand over to Georgia? Great. So Georgia, thank you so much for joining us today. I will hand over to you.
Hi everyone, good morning. Well, it's really nice to be part of this group. I mean, I think for the most part, we all know each other, so I feel like I'm back in old company and good company. But if there's anyone on the call who I have not had the opportunity to meet, my name is Georgia Dominic. I work as part of the disability team in the Executive Office of the Secretary General that was set up last year to support the coordinated implementation of the strategy. And you can go to the next slide, please. So I want to give you just a little bit of an update about what we've been doing since 2019. I know that you will have in different fora heard some of the information that I'm sharing. So I want to try to keep it brief and also to focus mostly on the humanitarian side of things and the work. But I just did want to just run through again very briefly about the strategy, because I know it's helpful and can be confusing. So basically, just to recall that the strategy has two elements to it. One is a high-level policy, and the other one is an accountability framework. And the accountability framework is what we're going to talk about today. It has two aligned components. The first one is an entity accountability framework that entities report under, and the second is a UN country team accountability scorecard that UN country teams report under. And the strategy, and this is something that we reiterate a lot, the strategy has a really wide-ranging scope. So it covers programs as well as operations. It's for all staff from headquarters to country level, and it covers all pillars of the UN's work: human rights, development, and peace and security, and also has a clear focus on humanitarian. And my colleague Gopal, who works with me in the disability team, we were very engaged in the development of the HAWG guidelines, and peace and security and humanitarian issues is something that we really push as much as we can in our work and make sure that it has the attention that it deserves. So you can go to the next slide, please. So without going into too much detail, what I wanted to share with you here was the overall rating of the UN system. So entities reported this year on their implementation of the strategy in 2019. And they rated on a 5-point rating system from approaching requirements, meeting requirements, to exceeding requirements, with options to also note that they had missed the requirements to achieve the indicator, or that they weren't applicable in some cases. And it wasn't surprising that what we saw at the end of the day was that the majority of the entities are either rating themselves as missing or approaching the requirements, with some meeting and exceeding them as well. So it just reflects what we had known before the strategy, and the reason for the strategy was that there are a lot of gaps in the system, but there are also some pockets of good practice. In terms of those that reported, there were 57 entities in the UN system that reported, and by entities we mean departments, offices, agencies, funds and programs, external agencies, or other agencies, as well as 7 UN country teams, and I'll tell you a little bit more about them. But one thing that I do want to highlight is the peacekeeping and political missions. They also, they reported it was about 37% of the total of peacekeeping and political missions that reported. And I'll go into a little bit more detail about them shortly. But basically what this overall report provided was a comprehensive baseline on disability inclusion that we can use to measure our progress over the years as we go. So if we can go to the next slide, please. So one of the things to know about the reporting by entities is that they not only report on the actions that they undertook in 2019 or how they rated themselves in the previous program year, they also talk about what are some of the actions that they are planning to undertake in the coming year to advance and to progress on disability inclusion. And that's where we really get some of the interesting bits of information, and we really see how the system is progressing. And I've just pulled out a few examples, and these come from the reports from the UN system, primarily from the agencies working on humanitarian action. So looking at the leadership, strategic planning and management sector, a number of entities are developing disability specific policies or strategies and did not have those in place before. Those who did not have disability inclusion as an explicit part of their strategic plans are looking to include that either this year, if that's their strategic planning cycle, or in 2021 or 2022. And also what we saw were that a number of entities are either hiring dedicated staff on disability inclusion, or they are establishing disability inclusion networks within their agencies to coordinate better on their work. Also, I think something extremely relevant, and you may have heard me say this before, but a really incredible thing to see throughout the reporting was the impact that the HAWG guidelines have had on how entities are thinking about humanitarian action and how they're working. We see that it's referenced in capacity development. They talk about how they can utilize the guidelines to support greater capacity of their staff. Also specifically in terms of consulting with OPDs, and that's something that we really see coming up a lot. Another area was in collaboration. A lot of entities talked about their participation in the HAWG task team as one of the ways in which they collaborated or coordinated together on disability inclusion. Some agencies, 7 agencies, reported that they worked on a joint program in 2019 to develop disability inclusive guidance on the HNOs and HRPs, which I'm sure Kirsten would be able to provide more information if you were interested. And just going back to the peacekeeping operations and the political missions, because they, I think I mentioned before, they are a really specific case. And we actually gave them their own section in the Secretary General's report, because they missed the requirements over the majority of the indicators. But what the strategy really did was pushed them to start thinking about disability inclusion for the first time and how they can really substantively consider that in their programs and their operations. And so even though we were seeing that for the majority of their work, they were missing the requirements, they were also putting down really concrete actions that they could take that would just shift the needle, as they've been saying in the UN, just that little bit more. And I think that, you know, that is really one of the impacts that we can see from the strategy. If you could go to the next slide, please. So I had mentioned that there are two components to the accountability framework. One is the entity accountability framework, and the other is the UN country team accountability scorecard on disability inclusion. I'll call it the scorecard from now on to save breath. And so the scorecard was developed after the strategy was launched, and it was finalized and endorsed by the UN Sustainable Development Group in the middle of this year, and has since been shared with all UN country teams, of which there are approximately 133. Now the scorecard is being rolled out in a targeted number of countries, in 10 countries this year, through a small rollout. And so we asked them, first of all, 7 of those countries to share their ratings or their self-evaluations on disability inclusion in 2019, as well as to share with us some actions that they have been, that they're planning to do with regard to the rollout. So just generally speaking, what we saw from those 7 UNCTs was that they really sort of matched the overall rating of the UN system. They're more skewed towards missing and approaching requirements with some good practice as well. The scorecard has a particular indicator on humanitarian. And so what I wanted to do was just to share with you a few of the actions that some of these UNCTs have or are planning to do in relation to that indicator in particular. And these are, you know, it's really great to see them because they're really practical. So firstly, looking at their existing policies, at their tools and resources, and thinking about, you know, how persons with disabilities are represented in that, how disability inclusion is addressed. And then secondly, looking at how to integrate it more where it doesn't exist. And some specific elements that were mentioned was integrating it in rapid appraisals, in the TOR of the humanitarian country team, and also in the emergency response plans. I mentioned before that entities were looking at the guidelines in terms of capacity development, and we see exactly the same thing happening with the UNCTs. They are also looking at that, and in fact, in some of our briefings that we've had with country teams, they are asking us about the ISC guidelines, and so that has been really great. And then also in terms of this humanitarian indicator in particular, we are really seeing a strong reflection on consultation with persons with disabilities, and that is either you know, the initial phases, which is sort of how to consult with persons with disabilities and their representative organizations from the outset, to you know, to the largest extent of exceeding requirements, which is supporting OPDs to be engaged within the clusters. So like I said, 7 UNCTs reported on the scorecard for 2019, but for this year we are, well, and for the 2020 program year, which will come out next year, we are expecting a far larger number. Next slide, please. So I won't take too much more time, but I don't think that it would be a presentation in 2020 if I didn't mention something about COVID-19. And it has actually had a significant impact on our work, for sure. You know, it came about at the same time that entities and UN country teams were reporting on 2019, and we did request them in April to include a section on COVID-19 in their report, and we'll do the same for the 2020 program year. But what we saw overall as a sort of a big picture was that COVID really illustrated the impact that the strategy has to convene the system on disability inclusion and to really move it. The SG produced a policy brief on the impact of COVID-19 on persons with disabilities with very particular recommendations. That's available in the link that is on the screen. I'm sorry, it's an incorrect link, so I'll correct that before we share the PowerPoint further. But following the policy brief, the USG Menendez, who heads our disability team in the executive office, she established a working group, a time-bound working group on COVID-19, which focused on 4 areas: on funding, on health and socioeconomic response and recovery, and on humanitarian issues. And that aimed to really achieve some tangible outcomes and to produce some very concrete resources. Also, those are available on the coronavirus page. And finally, just to say for this group in particular that one of the outcomes that we had was that the COVID-19 Multi-Partner Trust Fund, which is for all the UN system, explicitly highlighted the need for programs to be inclusive of persons with disabilities. So that was, a really tangible outcome that we saw from that, in addition to the resources that were developed. So I hope I haven't taken too much time. Happy to answer any questions, and thank you very much for the invitation to share a little bit about the work that we've been doing.
Super, thank you so much, Georgia. Really, really helpful to have that update. Really interesting. Thank you so much. So I'll hand it over to the floor and see if anybody has any questions for Georgia or any comments. We're a small group today, so please feel free to just jump in.
Or perhaps, Kirsten, it was so comprehensive, I answered all the questions.
Exactly. Well, if there's no questions today, it may be that some questions come up for you at a later point, in which case, please feel free to reach out to Rika and myself, and we can forward those questions on to Georgia, if that's okay with you, Georgia.
That's absolutely fine.
Super. Well, in that case, thank you again. You're of course very welcome to stay with us, but we also know this is a really busy time of year. So if you do need to drop off, that is totally fine. And we look forward to hopefully connecting with you again next year, and perhaps we could have another update later in the year.
Thanks very much, Kirsten. Thank you, everyone. Happy Thanksgiving to anyone celebrating. Bye.
Bye. Okay, I will hand back to Rika.
Should we move on to the next presentation?
Absolutely, yes.
So we turned them around a little bit. So is it now the time for the GLAD strategic planning, or should we look at the reference group?
Perhaps we can look at the reference group. So if Christian doesn't want to stay for the remainder, he'll be free to go.
Yeah.
Perfect.
Okay, I'm happy to shoot. Just 1 second, I share my screen with everyone. Oh, Kirsten, I don't seem to have...
That's okay, I could do it. I also don't have... Sorry everyone, always technical difficulties during this COVID time of working from home. Emmanuel, are you able to give me permission to share the screen? I will email the presentation to Emmanuel, while perhaps Christian, maybe you could introduce the co-chairs. Here we go. I'm okay now.
Great.
Wow.
Great, okay, excellent. Thank you, Kirsten. So hello everyone. So my name is Christian Modino. I'm the Humanitarian Director of CBM Global. and together with Elham and Kristin, one of the co-chairs of the reference group on inclusion of persons with disabilities in humanitarian action. So it's a pleasure being with you here. So we're going to take probably the next 15 minutes maximum just to present a little bit where we're at with the reference group. And happy to answer any questions at the end of the presentation. So yeah, can we move to the next slide, please? This is the whole presentation, Kristin.
Sorry, everyone, just a moment. Yeah.
Great, thank you. Yeah, sorry, everyone. I mean, we've been doing this presentation before in another couple of meetings, so we've slightly changed it for this meeting. So just to give you a bit of heads up of where we are with the reference group, and move on to the next slide. Thank you, Kristin. So as you know, just after the launch of the HAWG guidelines last year, the momentum was so great that we all felt that it was we were really need to have a group that will take the HAWG guidelines to the next stage, particularly around its implementation, awareness raising, and the whole rollout of it. So we established the reference group, and it was formally launched in February this year during the Humanitarian Network Partnerships Week in Geneva. And the reference group has mainly three broad objectives or aims. So one is fostering the collaboration between various actors on disability inclusion, particularly UN agencies, NGOs, and the disability movement, DPOs, and ensuring that the guidelines are properly disseminated through various means, which we will explain later on, but particularly foster that that strong collaboration between these three actors. And we know that DPO engagement has been one of the areas where a lot of more work had to be done. So we expect this group to really support these strong engagement from DPOs in humanitarian action. The other area is really engaging with the wider sector around coordination, technical and funding bodies, such as HAWG, the cluster system, Sphere, and other networks. But also bringing non-traditional actors that have a lot to to bring to the whole topic of disability inclusion, such as the academia. Lastly, we see the DRG as a very good platform and avenue to to keep informing the sector more broadly on progress around disability inclusion in humanitarian action through all the information that we can gather through all the members of the reference group. Next slide. So currently, where are we in terms of our status? So as I mentioned earlier, the group is co-chaired by IDA, CBM, and UNICEF, and there was an election process to elect the co-chairs earlier this year. We are formally established, through terms of reference, and we have internal standing operating procedures of how we engage and how we operate. Very interestingly, so since the establishment in February, now we are over 125 members, out of which, as you can see in the chart, a large proportion of the group is composed by international non-governmental organizations, UN agencies, and organizations of persons with disabilities. But we have also some network members like the CHS Alliance, for example, or ICFA, also represented in the group. We are seeing more and more national organizations, not necessarily just DPOs, but national organizations joining the group, and more also individual experts that are joining to to provide their expertise and contributing to the whole work of the DRG. We are strongly connected with results group, the HAWG results group 2. We are still not an associate member of HAWG, but our intention is to really collaborate very closely with this results group, but also with other HAWG associated entities such as the MHPSS reference group or the gender reference group. We have recently worked on a work plan, which Kristin and Elham will talk us through just in a minute. Next slide, please. So what have we been focusing on since February? So apart from all the work around setting up the reference group, which has been a bit of a tedious work, but very necessary, we have so far engaged in supporting the dissemination of the guidelines through various events. So during the HNPW in Geneva, when the group was launched, but we supported also a launch event in London back in March, where a lot of UK-based agencies were presented, including DEFID. We've had also an online launch event in Denmark. And we've also been, disseminating and presenting the HAWG guidelines through other webinars organized by PHAP, for example, or during the Annual Protection Cluster Forum. One of the flagship pieces of work that we've done this year has been the production of key messages on how to apply the HAWG guidelines to the COVID-19 response. This document was endorsed by HAWG, and it has also been disseminated through webinars organized by BHAP and ICVAN, the HAWG Secretariat, back in September. We are starting now to produce monthly newsletters. So this month we will produce the third one. This is a work in progress. It is intended also to reach the wider sector as we improve also the mechanism and the format. And so now I'm going to hand over now to Kristin to take us through the work plan, which has been recently approved by the group. Kristin, over to you.
Great, thank you, Christian. Before I go into the content of the work plan, I just wanted to touch very briefly on the process. So I want to give a huge thank you, and some of these people are on the call today, to a number of organisations that really took a lead role in development of the work plan. So what we did for the development of the work plan is set out 3 work streams, and I will describe each of these. Work stream 1 was focused on operationalising the IASC guidelines and also other global guidelines for disability inclusive humanitarian action. This work stream was very much focused on the field level, the country level, and very much focused on capacity building of humanitarian actors, recognising that the launch of the guidelines was really the starting point rather than the end point in terms of strengthening disability inclusive humanitarian action. So for this particular work stream, the development of the deliverables here was led by Humanity and Inclusion, Ulrike, who's online with us at the moment, working together with WHO, and that was ALACOS, the focal point. So what this work stream will be doing is collecting and disseminating effective practices and case studies of implementation of the IASC guidelines. So looking at sharing some examples of what can actually be done in practice and what disability inclusive humanitarian action looks like in the field. This work stream will also be producing and disseminating sector-specific sensitisation and learning materials on the guidelines. So developing really those operational tools that are intended to complement and support implementation of the guidelines. This group will also be working on developing a proposal, so developing an effective model for providing technical support to humanitarian actors. This is based on knowing that there are mechanisms in place for other areas of work, such as we have GenCap advisors, ProCap advisors. We don't currently have a similar system for disability, and so we're interested to see what could be an effective model for inclusion of persons with disabilities, learning from experience in the sector. So they're the key areas of work for this work stream. The next work stream that I will cover is workstream 2. So while workstream 1 is focused really more at that field level and at frontline humanitarian actors, workstream 2 then goes out to that global level. So workstream 2, what we're really wanting to do is to influence global processes more at a strategic level. So inputting to ongoing guidance, policy, strategy development in the humanitarian sector, and ensuring that inclusion of persons with disabilities is firmly embedded in those processes. So this work stream was led by UNHCR. So Ricardo was the focal point, Ricardo Bla Godera, and also by Islamic Relief Worldwide, Shireen. So thank you also to both of those colleagues who took the lead in this work stream. So this work stream will work very closely with IASC Results Group 2 on accountability and inclusion, and ensure that the reference group is really contributing in a very meaningful way to the deliverables from the work plan of IASC Results Group 2. This group will also work to support disability inclusion in the humanitarian program cycle, reinforcing the work that's already underway and which we'll hear about in a moment from the FCDO UN Humanitarian Single Business Case Group. I'm not going to go into too much detail about this because we are just about to have an update on this as well in just a moment. But basically, this is work that has been ongoing for quite some time around strengthening disability inclusion in HNO's HRPs. However, what we would like to support as a reference group is to ensure that there are DPO voices in that process, and also that we strengthen NGO engagement in that process, and that we really leverage the broad membership base of the reference group to be able to scale up that work and ensure that it's reaching the field level. Thirdly, this work stream will be working on inputting to revision of the core humanitarian standard and ensuring that inclusion of persons with disabilities really remains central to that framework. That is it from me. I'm going to hand over to my colleague Elham to talk us through the third work stream, which is on OPD engagement. Elham, over to you.
Thank you so much, Kirsten. Just to confirm if you can hear me well.
Yes, loud and clear.
Okay, thank you so much. Thank you, everyone. My name is Elham Yusufian. I am working with the International Disability Alliance as the Inclusive Humanitarian Action and Disaster Risk Reduction Advisor. And today I'm here with you as the co-chair of the reference group of inclusion of persons with disabilities in humanitarian action. So, continuing to what we just heard from Christian and Kirsten about the work of the reference group, since supporting and enhancing engagement by organizations of persons with disabilities in humanitarian action has always been a priority for all of us in the reference group, we dedicated a separate stream of the work of the reference group to this issue, which actually would have some cross-cutting feature, and the goal and all the efforts are directed toward ensuring that organizations of persons with disabilities are meaningfully involved in all areas of work of the group. For this purpose, in this stream, 3 areas of engagement have been marked. First of all, in collaboration with Workstream 2, the plan is to ensure that the accountability and inclusion portal, which Kirsten just talked about, is inclusive and accessible for persons with disabilities. So we will be coordinating, for example, resources and material to reach there, to ensure that they are CRPD compliant, and to make sure that the portal is accessible. Also in terms of, for example, the service directory, we will work to make sure that services related to disability are also available and reachable through that platform. And the second piece of work would be around enhancing the knowledge, expertise, and skills among DPOs to be actively involved in humanitarian work. In this regard, we will be organizing events and webinars, online or in person, hopefully, and to share this knowledge in a broader sense. And then for those who are more interested and want to get more actively involved in a more specific and more in-depth knowledge sharing. And finally, one of the concerns that was raised was to ensure that there is a platform for DPOs to exchange with humanitarians. So first of all, the plan is to have the opportunity for DPOs to share and transfer the knowledge, experience, and expertise among each other, and also to have a dialogue with humanitarians to exchange on how they can improve the collaboration and work together better to ensure disability inclusion in practice, in programming, and at every stage. So the overall goal is to try to overcome the barriers that DPOs face in getting engaged in humanitarian action. What we can see is that DPOs face three main barriers in accessing and getting involved in humanitarian work. First of all, humanitarian work is not traditionally something that most DPOs have been involved with. So many of them wouldn't have enough information or expertise, are not fully familiar with all the sometimes complicated mechanisms, how they navigate these mechanisms. So they would need that support, that in knowledge sharing and access to information and skills on that regard to get involved. And then, of course, this is the issue of access to humanitarian funding, which we hope to pursue the twin track approach. And this would be specifically interested for this group to talk about maybe later in more details. How to take the twin track approach in terms of ensuring that DPOs have access to humanitarian funding. First of all, through mainstreaming disability inclusion in humanitarian funding application processes and allocation of funding, and also to introduce and define maybe specific support, specific funding opportunities for projects led by organizations of persons with disabilities to try to overcome this barrier that currently really exists and hinders many DPOs from engagement in humanitarian work. And finally, of course, some of the attitudinal barriers that exist are kind of informing and ensuring that all humanitarian decision makers are aware of the potential contribution of DPOs, how they can get involved and meaningfully have input, not even only on DPO or disability related work, but also in the humanitarian work in general. And I think to overcome these attitudinal barriers, the ideas like the platform of exchange between DPOs and humanitarians is a good one. Also, like ensuring and enhancing the opportunities for direct engagement between humanitarians and DPOs and building partnership would eventually lead us to overcoming those attitudinal barriers and building the genuine commitments on the ground to engage with DPOs more and more. So we are not right now in the process of defining and putting together the mechanisms for implementation of our work plan. And as I said, for this purpose, of course, DPO engagement would have a very strong priority and cross-cutting nature. We are going to build small task groups for implementation of each of the areas of engagement that were just described. And of course, organizations who have like interest, capacity, and resources would take lead in collaboration with other members of the reference group to move toward the implementation. So we hope to start having more and more deliverables ready by 2021. Thank you so much, and happy to take questions again.
Sorry, Ilham, I'll just cover the final slide. So very, very quickly running through, I recognize we're going a little bit over time here, but just to support the work plan implementation, there's also a few other points that the co-chairs are following up on. One of them, Christian already mentioned, around strengthening cooperation with the IASC system. So while we have that relationship with Results Group 2, we are very interested in also strengthening that relationship with the other results groups, as well as maintaining our linkages with the UN Disability Inclusion Strategy team. We're also working on expanding our membership to non-traditional actors. Now, what we mean by non-traditional actors, it's both the people who we don't normally see at the table in terms of disability inclusion. So those mainstream humanitarian NGOs, mainstream humanitarian UN agencies, as well as the non-traditional humanitarian actors such as academics, private sector, etc. And we're also, it's very important for us that we're maintaining regular communication with states and donors, and that we have effective mechanisms for that. Yeah. So,
Thank you.
Sorry, Ilham, pardon?
No, it was not me.
That was Rika.
Rika,
yeah.
over to you.
Thank you. Are there any questions? I don't see anything in the chat, so if you have any questions, feel free to raise your hand. As said, we're quite a small group, so it's a good opportunity to exchange. If it was clear to everyone, it was a very good presentation, so thank you very much for that. So it was.
I have a question here.
Okay, perfect. Yeah.
Elizabeth Narrow from SIDA here. Thank you for the presentation, and it's really good that both the reference group now and we hear later on the HRP, and a lot of things are happening in this area, and there's a momentum, as somebody said. My question is whether we can in the kind of work on how we can set targets and make kind of the broader community aware that, you know, the kids are not going to school, people with disabilities don't have employment, there isn't any assisted devices, there aren't any early diagnosis and interventions, we don't see these kids in the child-friendly spaces. I think we have to be that concrete in order to really make sure that these kids and the adults are included. I mean, I still see in reports that there weren't any kids with disabilities in this camp. Well, if there's 30,000 people, you can easily just calculate how many people should be there. And so I think it's a matter of data, but it's also a matter of getting involved in these clusters and to also help the clusters to make sure that the kids are going to school. Okay, what does it mean for all kids to go into school? I mean, I even in when there's specific organizations working with disabilities, is every kid going to school? Yes, every kid with disability. Are the cognitive disabilities and mental disabilities? No, they're not going to school. So I mean, I think there's a need here to really look at targets, to really make sure that we get that they really get practical and move on to where to make sure that nobody is left behind. And then on expertise included, I think it's really good to put kind of the mainstreaming organizations and to put maybe those who are not usually around the table. One group that I've been missing is the experts, the speech pathologists, the occupational therapists, etc. I think that we will really to really get the programs included, we also have to use those groups. Thank you very much.
Thank you. Thank you very much. Would anyone like to comment on what was just said, or have further questions or comments regarding the presentation? You can either raise your hand or just unmute yourself. And if not, we can get back, well, we can come back to this topic at a later stage. Next one on our agenda is the FSDO UN single business case. Kirsten, over to you.
Thanks, Rika. Yes, and I'll be very brief because people don't want to be hearing too much from me today. But yeah, just to give a very brief update on the FCDO, which was formerly DFID, FCDO UN Humanitarian Single Business Case. For those who are not aware, this is basically a shared program between 5 UN agencies with DFID funding, FCDO rather, funding. And within that program, there is one results area on disability. This program has been in place since late 2017. And there's a group of agencies working together to strengthen disability inclusion in HNO's HRPs. So that advisory group is led by UNICEF, but also has participation from OCHA, WFP, IOM, UNHCR, WHO, as well as support from Humanity and Inclusion, CBM, and IDA. So as you may remember, this group developed some guidance which was launched in early 2019, but since then, there's a few updates that I can share. We did a review of the 2020 HNO's HRPs, and what we found was that there has been a huge shift in terms of strengthening disability inclusion in HNO's HRPs. So just to share one example, in 2018, when we did a similar review, there was no HNOs that had data disaggregated by disability. In 2020, every HNO had persons in need figures disaggregated by disability. The quality of some of that data perhaps does need to be improved, but it was still a huge improvement to just have that figure there. There was also improvements in terms of how the risks faced by persons with disabilities were addressed in those documents. So for example, in 2018, what we were seeing fairly universally were broad statements around persons with disabilities are vulnerable. Persons with disabilities are among the vulnerable groups, these kind of statements. In 2020, we saw more of the kinds of analysis that we want to see around what are the factors that place persons with disabilities at heightened risk, including barriers to accessing assistance. There's of course still a lot of room for improvement, which is why in the reference group, we're really keen to be working with this group to really scale up the work that they're doing. But there's definitely been some positive change. In addition to that, this year, the group has also developed a note on how to monitor a disability inclusive COVID response in the HNO's HRP. So basically developing a tip sheet on how to disaggregate data by disability in the COVID context, and also how to develop disability specific indicators again in the COVID context. The group has also done an exercise where we looked at a number of humanitarian country teams and tried to understand a little bit what are the factors in terms of country dynamics, what are the factors that facilitate disability inclusion in HNO's HRPs, and what are some of the challenges? So going beyond the documents themselves and really understanding those dynamics at country team level and what we need to reinforce. And then lastly, the group is also now in the process of developing a self-assessment tool, which we will be sharing with country teams so that they themselves can do their assessment of early drafts of HNO's HRPs and to see where they can strengthen. I realise that's a very brief update. Similar to the point on UNDIS, if there's an interest in this group to perhaps have a more detailed overview of that work in 2021, that's certainly something we can do. But for now, I will leave the brief update there and just check if there are any questions.
Again, feel free to raise your hand or just unmute yourself if you have questions or comments to what was just said. Let's see if I have anyone. I don't see any hands up, so I guess it was again very, very clear and coherent presentation and comprehensive. So if there are no comments, then I'll hand over to Ellen for an update on COSP.
Thank you so much, Rika. Yeah, as everybody in this group, I think, should be kind of involved with the Conference of State Parties to the United Nations Convention on the Rights of Persons with Disabilities. It usually happened in June, but this year, because of COVID, it's now rescheduled in a digital way to start next week on Monday, November 30th until Friday, December 4, including the December 3, the International Day of Persons with Disabilities. Quite a number of interesting events around humanitarian are happening, including one event about the situation of persons with disabilities in Colombia in Spanish on November 30th, and also another event on gender-based violence by CARE International. But what I wanted to specifically highlight is also the Civil Society Forum, which is happening on December 2nd. Traditionally, the Civil Society Forum has been always organized one day before the actual conference, just for the civil society to exchange, build on what has been achieved so far, and just kind of strategize, plan, and support each other for future achievements. This year it's going to be also online. It's going to start at 10 a.m. New York time, which would be 4 p.m. for colleagues in Central European time and 3 p.m. for colleagues in the UK on December 2nd. The session will have a 1 hour specifically dedicated to humanitarian, or as we call it, how to live in urgent mode, which seems to be the mode of our lives in 2020. Specifically, we're going to discuss challenges that humanity is facing and how these challenges are compounded for persons with disabilities, including in the areas of COVID-19. Specifically, we are going to discuss what we suggest the distribution of COVID-19 vaccination should be. And also we're going to talk about climate action, which I think all of us would agree is going to be one of the main barriers and challenges for humanity for the next years to come. So we want to see how disability disability community would be involved in this issue. There has been some very interesting activities started around, and we will be briefing you very quickly, the participants around that. And finally, of course, we're going to talk about the inclusion of persons with disabilities in humanitarian action and introduce the platform of the reference group in case like some of the civil society are interested to learn about it. So that would be the session on Civil Society Forum. And then on also there would be another interesting event on the Security Council Resolution 2475. As probably many of you are aware, this groundbreaking resolution was adopted in 2019 by the Security Council of the United Nations on inclusion and equal protection of persons with disabilities affected by armed conflict. This event is sponsored by governments of Poland and Germany, who both led the process of adaptation of the resolution in 2019. They were both members of the Security Council then. and also, of course, sponsored by International Disability Alliance, Human Rights Watch, the United Nations High Commissioner for Human Rights, the government of Mexico just recently joined. This event would be to explore, the achievements of the resolutions and discuss the way forward, how we can make sure that this resolution is actually being implemented. So we will be sharing a kind of email with all the information about all these events with all of you, so that you can, if you're interested to register, you would have the link to do so and put it in your schedules, and look forward to any questions that colleagues may have. Thank you, Rika.
Thank you very much. Do we have any questions? No, doesn't seem like there are questions or comments to this, so we can move on and discuss more about GLAD and its strategic plans. And then the last point on the agenda after that one is this working group and our plan for next year. Yeti, the floor is yours.
Do you hear me, Rika?
Yes, we can.
Okay, sorry, I had a challenge addressing. So sorry, I just joined, so I just lost track.
Yeti, so we're onto the agenda item on the GLAD strategic planning process.
Thank you. Okay, thank you so much. Thank you, Christine. So hi everyone, and sorry for joining late. I had another platform that I was supposed to do a speech. So just a brief update on the GLAD strategic plan. Thank you for those of you who have really inputted as well as joined us in the key informant interview. So the GLAD member survey that we had initiated in early September was closed early October. So we were able to get responses from our members. I would say 86% of our members responded to the survey, which was really fantastic in this survey fatigue era, where people are so tired of filling out surveys. So we have finalized analyzing the data from the survey, as well as we have conducted key informant interviews with 12 key stakeholders, including some GLAD members, as well as non-GLAD members. So that was very helpful for us to really also see how others outside the GLAD network view us and the work we do. And at this point, we have finalized the first draft of the strategic plan. And tomorrow, there will be a discussion on the draft strategic plan in the core team. Sorry, I failed to explain who the core team is. So at the beginning of the strategic planning process in July, what we did was that we worked on a concept note, as well as showing the structure of how the strategic planning process will be undertaken. So a core team consisting of the 3 GLAD co-chairs, being IDA, Norway, and the UK, as well as 3 co-chairs from the working groups that we have. Diane Reckler from the Inclusive Education Working Group, Christine from the Humanitarian Action Working Group, and Ola from the Social Protocol Working Group, as well as myself from the Secretariat, make up the core team for the strategic plan. So the core team will be now reviewing the strategic plan tomorrow, and next step will be that upon incorporation of comments from the core team, we will take that, maybe an advanced draft to the steering committee sometime mid-December up to mid-January. I'm sorry, I cannot tell the dates yet because the core team needs to agree when to present it for the steering committee. Then we would hope after the steering committee reviews it, it will be open to the network, and we may even seek working groups have a focused discussion about the pillars which are of direct relevance to their work. I think that will take us into end of February, where the strategic plan will be officially adopted by the annual general meeting of GLAD members. That's it briefly from our side, but I'm happy to respond any questions from the working group. Back to you, Rilke.
Thank you very much. Are there any questions or comments? I don't see any hands up, and no one is unmuting themselves, and so I guess we can move on and continue discussing next year and our plans for that. I think it nicely fits with the discussion on the strategic.
Oh, sorry, Rika, you just cut out.
Sorry.
Yeah.
Can you hear me now? Okay,
Yes.
Thank you. So one of the things in the strategic plan for GLAD for 2021-23 is, or on the paper, is the formation and operation of working groups. And it's put quite nicely that we need to break siloed approach also when it comes to the GLAD's working groups, and come up with innovative ways of intersecting each other and add value to one another's work. And this is something that we have, as co-chairs, discussed quite a bit. Sort of, what is the best way to ensure the inclusion of persons with disabilities in humanitarian action across the board, and where does GLAD fit in this work? We've had quite a few updates today from various groups and various initiatives discussing this. As a result, we would like to pose a question to you and see, do you think it is of relevance to have a separate working group for humanitarian action? Or do you think that our efforts would be more effective and we would reach even better outcomes if we were, in fact, mainstreaming humanitarian questions into the now working groups of education and social protection? Just before joining this meeting, I was listening to a webinar by Danish Red Cross and the EU on the triple nexus. And that's definitely something that, well, it's also been mentioned during this meeting. Well, and it is clearly something that we need to be more conscious of. And that is also an added reason for us to think how to make sure that the sectoral working groups that we have are comprehensive of both humanitarian questions and those of development matters. If we don't have, for example, in education, inclusive education in both contexts, we're not going to reach the objectives we share. So over to you. What do you think? How do you see we should move on in 2021 to make sure that as GLAD members, we can enhance inclusive humanitarian action in the most effective and efficient way? Feel free to just comment. No need to necessarily raise up your hand if there's anything you would like to say.
I can go again if you want. Elizabeth again.
Perfect. Go ahead.
I think it's very good that we use our resources in both, and in both the development and humanitarian. To a large extent, it's the same questions. How do you get these kids in school? How do you make employment accessible for people with disabilities, etc.? But there are certain mechanisms in the humanitarian are a bit different. It's the HRPs and the HNOs, and it's the clusters, and also the kind of the refugee setting and the OCHA setting. And those are a bit different. And I think that we have or you have really started working on these mechanisms. So I think that I would think that needs to be continued. There's also the protection issue in the humanitarian, and that's something I forgot to say before, that now with Ethiopia, and I'm also working on Mozambique, I don't see enough protection issues when it comes to people with disabilities, and to work on the IHL issues, and how do you protect people in conflict settings. I mean, we see the people who have left both Mozambique and in Ethiopia, and we just know that a lot of people with disabilities cannot leave. So how do you protect people with disabilities? So I think that's something that has to be maintained, and that is a bit specific in the humanitarian. So I wouldn't want to leave it totally, but I think that a lot of it can be, but a lot of the technical issues can be put in the working groups. Also, there's other issues than just education and social protection. So the humanitarian also needs to work in all the different clusters there. So good to work more, but I think it's a shame to leave the humanitarian, especially when I think that there's a good start here. But I miss, like I saw now that, for example, in Afghanistan and Nigeria, I think DFID and maybe somebody else in Afghanistan have put somebody in the humanitarian country team, and put an organization to their to their use. I think it's CMD in one case, and I've just heard that it's been really popular and really appreciated by the other actors. So maybe one objective for next year is to get down in the field and really see how can we support the country teams. You were talking about the GenCap and the ProCap. I think that's excellent proposals that we need to work out more. So how to get this more into the field and the knowledge out to the organizations. I know many that and to try to test different ways of working there. I know that in some of the refugee settings, for example, can be more. There's a lot of good projects going on, but they could be also more strategic work of looking how you do a strategic plan for people with disabilities, or how do you strategically look at the different needs for inclusion, for example. Those are the work that also could be done in other humanitarian settings with the help of the humanitarian country team, for example, or in certain areas, regions, where you look at, okay, how do you really, who are the people, and how do you make sure that they are really included. And I think also some of the inclusion issues are more easier, and some of the inclusion issues are more difficult. And the more difficult ones are where people are more affected by the disability, for example, in school settings, etc. And I also think it's very important to use a twin track approach here, specific needs for people with disabilities and the mainstreaming. So I wouldn't want to miss it, because I think there's been a lot done, but I think we have a lot ahead. That's my take on it. But very much more, I think that the learning from the humanitarian can definitely more be involved in the working groups on education and social protection. I'll stop there.
Thank you very much. Ulrika, you had a comment? You have your hand up.
On behalf of IDDC. I'm from HI originally, and perhaps I would really support from the IDDC perspective, but also from HI, so I can't speak of all IDDC members. but looking at the work ahead with regards to making sure that persons with disabilities and OPDs meaningfully participate in those aspects, which were just mentioned by Liz. I think it's really beneficial to still have a humanitarian action working group, but also to make sure that, as was mentioned before, inclusive education in emergency is then also addressed, perhaps in the other working group, as well as issues of protection, but also assistance through cash transfers as a modality, and accountability mechanisms are raised perhaps in the social protection working group, so that we really, that would be a recommendation to also make that nexus work by mutual collaboration on these topics, but also looking especially at the work plan presented by Kirsten before. I think it's really great to still have for some time the humanitarian action working group going, also to address some of the protection issues we see very much in the field, still not being addressed sufficiently to have equal protection for persons with disabilities in humanitarian emergency. So I would fully agree with what my speaker said before me. Thank you.
Thank you very much. I don't have any hands up. So one of the questions I would like to ask is how do you see this group, so the GLAD Humanitarian Working Group, as different to the reference group? So earlier when we had the presentation on some of the action points, it was really on the reference group. So how can we best complement that work, or can we? And yeah, over to you. Because as the other speaker said, there is a lot of work to be done, and definitely a lot of work to be done also in terms of humanitarian action. That is something we are not questioning at all. What we're trying to get to is what is the best way to ensure humanitarian action is effectively considered within GLAD's work, and how can we as humanitarian action actors best contribute to GLAD, and what can we as a GLAD do without there being too much duplication of efforts with the group of friends, with the reference group, and so on. Okay, I know this is a big piece to consider. I don't see any hands up, and so if there are no further comments to this, then I guess we will continue discussions as chairs and together with the secretariat, move forward with our thinking, and have some concrete proposals for us to consider in January in the next meeting. However, feel free if you now thought further how you see a best way forward, please let us know. Kirsten, Yeti, is there something you would like to add to this?
Hey Rika, and this is Kirsten. No, there's probably nothing I would add. I think you've covered it very well, the question that we have. I guess just to reiterate what you also have clearly communicated, that we do recognise that there is a lot of work that does need to be done in the humanitarian space. Our question is really, how can the GLAD network best contribute to that, knowing that we have we have the reference group now where many of the GLAD members are also participating? And is it potentially a more effective use of our resources in GLAD for us to focus on mainstreaming humanitarian into the other working groups or not? So yeah, just to reiterate the question that you've already stated very clearly, but nothing to add on my side. I look forward to having more discussions on this also going into 2021.
I don't see any hands up, so if there are no further comments to this or questions regarding the other topics we've discussed today, then from my end, I'll just say thank you for your participation. Feel free to send us any comments or feedback or questions after this meeting via email. I said I know it's a big question and you might need some time to think about it. We're very happy to hear from you and have ideas to make sure that as GLAD we're using our resources as best as possible. But if there are no further comments, then thank you and wishing a lovely holiday for those of you celebrating the end of this week.
Thank you, everyone.
Thank you.
Thank you so much.
Thank you. Bye.
Bye.